It's an honor to introduce today's speaker, Dr. Scott Jensen. Here are some of the words that describe Scott: character, integrity, honesty, principled, respect, righteousness. I was fortunate to meet Dr. Scott Jensen 28 years ago in 1992 when I began my job as the new city administrator in Watertown. We worked in the same building on Highway 25, Lakeview Clinic. He was a doctor upstairs and I worked downstairs on the lower level, which was City Hall. We became fast friends as leaders in the community, Watertown Lions and Watertown Chamber of Commerce, to name a few. He was the best doctor around, hands down. His engaging personality and professionalism were second to none. Everybody wanted him to be their doctor, including me, and he did. Just like my wife's parents, Irv and Marilyn Atkinson from Waverly. Doctor, father, mentor, role model, husband, community leader, entrepreneur, businessman, teacher, professor, state senator, and most importantly, friend. It was a few years back, I was at the state capitol lobbying as a city administrator, and I stopped by his office to say hello. Without hesitation, he invited me in. I didn't even have an appointment. Now, we hadn't seen each other in 17 years since we moved to Maplewood in 1998. And there it was. We picked up right back on what was new, how we liked being a state senator from Chaska, and the family updates. Fellow optimists, I'd like to introduce to you Mr. Positive, my good friend, Dr. Scott Jensen.
Well, thank you very much, Mike. Well, it's a privilege to be with you today, and congratulations to all of you. I've often thought that it's so much better to be a naive optimist than a jaded cynic. And I think that in the world of politics, we're challenged to remain optimistic. I think what I'll do is I want to talk about relationships. And I mentioned it with Don and Terry that I'd focus on that. There might be some questions about COVID-19, and I'd be glad to answer those. But I thought that if we started out with relationships in medicine and politics and business and education, I thought that might be helpful. So, Terry, if it's okay with you, I'll plan on speaking for about 15 minutes and then go to question and answer. Okay.
That'd be great.
Sounds good. Well, I think I wrote a book about 5 years ago, and it was called Relationship Matters. And what it was 33 chapters about the first 33 years of medical practice for me. And the underlying theme was that as a physician, one of the best things I can do for my patients is build a relationship in such a way that we can get the patient to understand that I am going to advocate for them. And if I do that effectively, hopefully the patient will learn to trust me. And then when you get that spiral going like this, where advocacy and trust build on each other, I think then you've empowered your patient to take charge of their healthcare. And I think that's where we get the best healthcare, is when patients feel, if you will, up to the task of championing their own care. So if patients want this to be the priority, they'll choose this. If they want that to be the priority, they'll choose that. And so when I wrote the book, it really gave me a chance to crystallize what I thought was important in the world of medicine. When I started writing the book, I had no intention of running for politics. My wife and I returned from Israel on May 1st, 2015, only to be confronted 5 days later by some persuasive legislators asking us to run for the Senate. For 2 months, we said, no, thank you. But after 60 days and some heartfelt soul searching, we ended up making the decision to do so. What I found was a 4-year term in the legislature is a little bit similar to a 4-year term in medical school. And I think that there are parallels that we should talk about today. But I also had a chance to tap into my experiences back in Carver County when I sat on the school board for 10 years and learned a lot about K through 12 education. And in the Senate, I was on the Higher Education Committee for 4 years. And with my school board experience, I feel like education is something that's near and dear to me. And then lastly, the world of business. I think in a sense, the relationships we do or don't build in business profoundly affect our satisfaction with our life journey. And I think that's critically important as well. So I'd like to touch on relationships as they fit with medicine, politics, business, and education. I think that we all have to build relationships and decide how we're going to care about others by determining our own recipe, if you will. And that means that there are certain ingredients that matter. And for me, some of those ingredients center on self, some of those ingredients center on others, and some of those ingredients center on survival. So I'd like to start out with my own recipe for how I feel relationships matter and come into play. First off, those relationships that focus on self. I especially found this to be very true in the Capitol, right out of the blocks in 2017. I needed to find a compass. I needed to find a way to help me navigate the Capitol. And I'm not talking about the geography. I'm talking about the various machinations and operational details, and, if you will, some of the manner in which sausage is made. I needed to find a compass. And I think that's critical in almost all of our relationships. I also needed to, if you will, develop a competence. I needed to get at some level of competence with virtually any issue that I would address. And that didn't mean I had to be an expert, but I certainly had to understand the basics. I remember a phrase, riparian buffer zones. And I had no idea what that meant initially, but I learned a lot about it. And that spilled over into the right of a person to do with their land what they wanted, the right of a government to step in and say, for the greater good, we need this to happen. But I think in order to deal with, if you will, others, whether it's in medicine, business, education, or politics, you have got to develop a competence with the basic issues. I also found that complaints aren't necessarily what they seem to be. Sometimes we think that complaints are negative and that it's okay if they arouse a defensiveness in us. But oftentimes complaints are nothing more than ideas for the future. When someone complains, if we can get past their complaint and start to explore what triggered this, and then from there start to build some common ground of understanding, oftentimes we'll come up with an idea that's good for the future. I think compassion is absolutely critical. And each person has to find their own way in which they can dig into their wellspring of compassion. I know that in healthcare, many people complain about the fact that their doctors don't seem as committed to them, to the patient, or even to the field of medicine. We're even seeing some of that with COVID-19. What is the priority for physicians? Is it the relationship with their patients? Is it to stay out of trouble? Is it to stay off the radar screen? But compassion does something that oftentimes we don't realize in medicine. Compassion allows us to have a longitudinal career that's imbued with the satisfaction of relationships, and each and every day has its own miracle of caring. And I think without compassion, you don't get that. And I think politics is the same way. If every time you encounter a constituent or a citizen, you think of it as one more box to be checked and not as a way to grow your compassion, the day gets long. I think it's by having compassion for what a person is in front of you for. Let them teach you. Let them show you that their concern should be your concern. And I think compassion is another one of those ingredients that really make the journey a richer journey. I think compromise is unfortunately becoming a dirty word in the world of partisan politics. Compromise isn't giving in on core convictions. Compromise is sort of Stephen Covey saying, seek first to understand, then be understood. If I don't take the time to ask you to help fill me in, help me understand why you see this situation or this perspective the way you do, I'll never be able to get you to see the way I see it. And I think we're always better off starting with the Covey axiom that seek first to understand, then be understood. Don't start out by trying to convince the other person why you're so correct. Start out by saying, help me understand where you're coming from. And I think when we do that, I don't think we're compromising. I think we're simply trying to go through that exercise of building and finding common ground. Compromise is a way of life. Two humans wired to be independent and autonomous, whether it's in a marriage, whether it's in a business partnership, whether it's a father and a daughter, a mother and a son. It's the only way that we can work things out. Compromise is nothing more than community living. And I know that one of the things I always respected about Mike Erickson was that he understood that community didn't mean that we were going to identify who the winners and who the losers would be. Community meant that we were going to go through that process of politics, because at its core basis, politics is nothing more than people learning to live with each other in a community. And lastly, common sense. Common sense is an ingredient that we have to try to generate within ourselves. And we have to realize that our common sense isn't someone else's common sense. And I think in the world of politics, we have to realize that common sense isn't very common. And I think that's the case also in medicine. In medicine, if you really want common sense to touch and shape the relationship you have with your patients, a physician is best off leaning into the patient, because oftentimes it's the patient that brings the common sense to the relationship. It may be the physician that brings the chemistry and the biology and the physics. But if all we have is chemistry and biology and physics, we probably don't get meaningful healthcare, because without the common sense, without the shared buy-in, we're not going to change behavior. We're not going to change those, if you will, essential factors of healthcare, lifestyle, mental health, ideal nutrition, exercise, all those things that are really the most important parts of healthcare. So those are sort of the ingredients that I think I have to devote myself to building. But then there are ingredients that I think are more other-centered. And what does that mean? Well, that means I really have to focus on centering on others. I need to connect. And the only way I can connect is ask others to educate me. Almost everybody we meet in a given day can be our mentor if we let them. Let people teach us. Ask them to teach us. Teach me how to do that thing that you do. Teach me how to understand how you do that. I think another one is conversations. In the world of politics, it's distressing to me that some of the crucial conversations are oftentimes not allowed because they're dangerous. So politicians will deflect. I know that during my 4 years in the Senate, I was able to get myself in hot water numerous times. And oftentimes it was because I refused to not have the conversation. I remember voting with the party across the aisle on an amendment at 11 o'clock at night regarding MinCare buy-in. And I remember I was so upset that the major insurance carriers in 2017 decided to not, if you will, participate in the creation of opportunities for individuals to buy health insurance in every county. The big health care insurance companies were willing to do it for the counties that looked to be favorable from a business climate. But if you were in Kitson County in northwestern Minnesota, that might not be a very good place, a place where you could lean into your actuarial data. So some of the insurance companies didn't bother providing a plan. So when the Democrats put forward an opportunity whereby if there were no individual plans available to you in a given county, then you would be offered the opportunity to buy into MinCare. I didn't know if it was a great idea, but I knew it had to be a conversation to take place, because without it, individuals weren't going to have the same opportunities that people would have if they received their health insurance through their employer or through a public program. So I think politicians don't get to deflect conversations that are crucial. I remember getting myself in hot water when I said I would be willing to participate in discussions regarding the use of our background check system with guns. Well, we have to have those conversations because Minnesotans wanted those conversations to take place. I think the same parallel can be said about physician-patient relationships. Physicians don't get to say to patients, we're not talking about that. Patients are there to learn and receive healthcare. An example might be today, what about early outpatient treatment of COVID-19? Should patients be left with a binary choice when they get COVID-19? Should it be get better on your own or wait until you get worse and land in a hospital? Because many patients feel that that's what they're being left with. And many patients feel like they would like another choice, a third choice. If they have COVID-19 and they're not necessarily getting better, but they're certainly not bad enough where they have to go to the emergency room, and they certainly don't want to go in the hospital anyway. Is there something we can be doing early on an outpatient basis? Are there therapeutics available? Do zinc and vitamin C and vitamin D matter? Could even a short-term 5-pound weight loss provide some advantage for our immune system? Does azithromycin or ivermectin or dexamethasone or budesonide or hydroxychloroquine, do these things matter? Do they have a role? I've heard horror stories from patients saying that their physicians absolutely blew them off because they wanted to have that conversation. That's an ingredient that we need to reach out to others. Crucial conversations have to be allowed to take place. I think we have to also realize that confusion teaches. When we run up against confusion, we shouldn't run from it. I find myself going on my Google app and my Wikipedia app and my Webster's Dictionary app every day because I'm confused by something. Oftentimes, I don't realize how confused I am by something until a patient or a constituent asks me, how does this work? It's in the confusion that I dig deeper and teach myself a better understanding. If you can't teach someone about it, about a concept or about a medication, it may well be that you don't understand it as well as you should. So I think we can embrace confusion as a powerful motivator to learn more. And I think conservative reasoning has to be understood for what it is. The word conserve comes from Latin, conservare, and it means to safeguard. So when we try to conserve a relationship with a patient or a constituent, we're not necessarily talking about our position on a political spectrum. We're talking about trying to safeguard something. If we're trying to conserve the Constitution of the United States, that might mean that we're trying to safeguard it from abuse or manipulation. If we're trying to conserve the essentials of a patient-physician relationship, that means we're trying to safeguard it. We have to be careful not to let someone hijack a term for their own use. And I think we've done that. I think sometimes conservatives try to say that they're the only ones who are conserving. That's not true. Independents, libertarians, Democrats, people of all labels try to conserve or safeguard that which is important to them. And we have to be careful how we let these labels touch and shape our conversations. And I think we need to understand that conforming isn't always a good thing. Groupthink is dangerous. In the world of politics, I've been absolutely impressed with how easily we slide into an existence within an echo chamber. We surround ourselves by people who say yes to us. As elected officials, we're oftentimes sort of taken by having people fawn all over us asking for our time. And I think when that happens, I think we sometimes think that living in an echo chamber is okay and it's safe, but I don't think it gets us where we need to be. I think confrontation is avoided too often. We can confront one another. We can disagree with one another without being disagreeable or without being excessively confrontive. If my wife tells me, Scott, you might be a better golfer than me, but I've noticed when it comes to taking out the driver on every hole, I think there are times where you should hit an iron. Well, now, she's not necessarily trying to get in my head. She might just notice that every time I take the driver out, it seems I'm losing a golf ball. And I think that we need to do that. We need to understand that confrontation can be okay. And honestly, I think confrontation can be the step that precedes building of consensus. The only way we're going to build consensus is if we allow ourselves to be confused, learn from that, and then allow people to confront us. So lastly, in my recipe as to how do I build relationships, I think there's another group of ingredients that we have to remember. And those are the survival ones. You don't survive in the world of medicine or in the world of politics, in the world of business, or in the world of education without having some core values. I've been blessed to know a lot of teachers that are incredibly committed to helping kids. I think every one of us on this Zoom call probably can recall from our school days a handful of people that profoundly touched our lives. I remember Mr. Young teaching me mathematics, and I remember Mrs. Zahn teaching me Latin, and I remember Miss Dersher teaching me theater, and I remember Spanish being taught by Miss Weisman. I remember these powerful influences on my life. And the reason they were powerful influences on my life was they had core values, and those values were not plucked out of thin air. They were forged. They were forged by life experiences. I like to say that good judgment comes from experience. And some of my most valuable experiences came from my own bad judgments. Our core values are forged. We don't get to pluck them out of thin air. And lastly, I think courage is one of those survival ingredients. Without courage, we really don't take the time to be authentic. We don't dare be honest. In a few minutes, we're going to do some question and answer. And I may well say something that some folks appreciate and some folks disagree with. But if I don't have the courage to answer your questions, then I don't have that ingredient that would help you and I survive together. So when it comes to relationships, I've been blessed to have the chance to go through medical school, to be in the legislature, to write a book about relationships, to be in the world of business, and to be involved in the world of education. And for me, I have to find my own recipe. And that means I've got to find the ingredients that are going to make me a better person. They're going to help me reach out to others. And in the end, I have to have some core convictions that'll help me survive. So that's sort of about me and my experiences. And I'd love to have questions and answers, provide more of a laser focus in terms of what you might be interested in. Terry, back to you.
Thank you much, Doctor. Folks, Mike, I want to let you pick up here, but two things. One, if you could, if you want to type a question in the chat, or if you open your participants window, there's a raise your hand, a little raise your hand button, and we will call on you, we'll unmute you. So with that, Mike, I'll let you see if you've got a question or two, and we'll kind of go from there. We'll watch. Karen, if you can help.
Yep. Scott, so my question, of course, you and I have known each other a long time, and you are someone who is incredibly principled. Could you share with everyone your decision to leave Lakeview Clinic and open up your own clinic? And it's a remarkable story, everybody, but Scott is someone who, when he's going to do something, he's going to do it right. And he, as an entrepreneur, as a business person, as a doctor, he formed a new clinic and actually built a new building right on Main Street in Watertown.
That was 20 years ago, and I'll never forget it. I remember Johann von Goethe made a comment, something like this. He said, when you dream about something, you're dreaming. But when you start to actually put one piece of the equation after another, things will happen that you could never dream. And that's what happened. I was with a clinic that was and is a very good medical clinic. I was with them for 15 years. When I joined them in 1985, it was a small family-based group. But as happens with success, this clinic grew. And from my perspective, we grew without necessarily taking the time to identify who we wanted to be. And when an organization goes from perhaps a family-centered organization to more of a corporate-centered organization, it's easy to change. But I don't think it's about winners and losers. When I decided to leave that clinic in 2000, I felt simply that I was a square peg trying to fit in a round hole. And it wasn't that someone was right and someone was wrong. It was that I didn't fit. And I felt myself in the morning feeling like I was getting on a treadmill. And I wasn't enjoying my patients as much as I wanted to. I'd worked hard to get into medicine. I was in dental school first. I was president of the dental school class. I would have loved to have been a dentist, but I learned that I didn't like teeth. So it didn't work very well for me. I did the logical thing. I went to the seminary. And in the seminary, I really realized how much I enjoy people. And so I made the decision in the seminary. I made two big decisions actually that year. I decided to ask my girlfriend to marry me. And Mary and I have now been together 42 years. And I made the decision to go into medicine. And once I got into medical school, I knew where I was going. I was going to go into family medicine because that's where the relationships are. That's where I get to combine the science of medicine with the wonderment of the human psyche and the human mind. And you get to have relationships. So in 2000, I went ahead and decided to build my own clinic. We built Catalyst Clinic. I didn't want it to be just another medical clinic. I knew I was going against the grain. In a time in medicine where most, if you will, independent private clinics were going a different direction, I was moving into the arena of building a clinic whereby I was on call for 365 days a year, 24/7. But we decided that every room in our clinic would have a theme. We've got a golf room. We've got a tractor room. We've got a garden room. We've got a poo, Potter, and pals room. We've got a map room. When people came into our clinic, I didn't want them to feel like they were just walking into a sterile medical building. I wanted them to know that they're walking into a place where they were welcome, where I wanted them to be comfortable, where I would insist that they would be the champion of their healthcare and that I would be, if you will, their support person. If there was a professional golfer in the room with me when I'm seeing a patient, the professional golfer, the Tiger Woods is my patient. I'm the caddy. I'm the one who carries the clubs and tells my patient that there's a sand trap on the right and that the wind is in their face. So when we did that in 2000, I could never have dreamt that we would achieve the success we have. And we learned to work with the neighboring clinics, and that's been a blessing. We continued to work with Ridgeview Hospital in Laconia, and that's been a blessing. We built another facility in Chaska, and that's been a blessing. And now there are 6 of us, 6 providers, and we all love the relationships we have with our patients. So, Mike, sometimes people have said, how did you think about it, Doc? How did you figure out how to do this? I didn't. I think the good Lord saw a Norwegian walking down the sidewalk and said, I think I can use that guy. But I would never want to take credit for all the good things that have occurred. You and a ton of city administrators have worked with us along the way. The people of Carver County have been unbelievable support people. And honestly, I've got the best patients in the world.
Great.
Thank you.
We have a question from Mary Jo McGuire. Mary Jo?
Thank you so much, Scott. It's good to see you. We have a mutual friend that I'm not sure we've talked about, Teresa Kittredge, who is I know a good friend of yours. She's a good friend of mine. She, I know, is a strong supporter of you. I have a question since I formerly served in the legislature, and we have a Steve Daler also, and you've chosen not to run for re-election. So my question is along the same lines of Mike's. You know, it's always hard for us who have left the legislature. We like to have good people stay in the legislature, and it's always hard to see good people leave. And I totally understand how life circumstances, you know, make it better, you know, make it so that you don't, you know, run again. But I'm just curious if you want to comment on your decisions to not run again for the legislature, and what just maybe some thoughts, some parting thoughts of leaving that process. Because thank you for your work in there. I think it was probably difficult to work. It's difficult in that atmosphere, but if you could just make a few parting comments about that.
Thank you very much, Mary, for that question. I'm going to actually take three pieces out of that question and respond to them separately. First off, you made a comment about Teresa Kittredge. I don't know if folks on this Zoom call know Teresa, but she leans liberal on the political spectrum. She has absolutely been a mentor of mine. When I decided to run, someone told me, they said, you need to meet these 4 Democrats and you need to build a relationship. And Teresa was on that list. And I met with Teresa, and she was so gracious in helping me understand how she sees and dissects a political issue. She's been absolutely critical to helping me understand how to make my way in the legislature. She's been a part of my compass, and I'll forever be grateful. And I'm sure that she and I disagree on at least 10% of the issues. But as Ronald Reagan said, if you've got someone who agrees with you 80% of the time, you don't have a 20% enemy, you've got an ally. Second part of your question, when I decided to not run for re-election, I was truly disillusioned with the bickering and the partisanship. This is not what Minnesotans want. We're not elected to go down and draw lines in the sand. I felt like we weren't honest. I felt like I was being ostracized because I refused to go along. I voted with the other side of the aisle at least a half a dozen times, but every one of those, I felt that my core convictions led me to do that. And it was okay from my perspective that people didn't like it, but I thought they could at least respect it. And that didn't always happen. And then alongside of that, Mary and everybody on the Zoom call, were some health issues in my own family. And I thought, I haven't really been there. And for them, because the legislature was all consuming, and trying to practice medicine full time and being an active legislator, it was a big deal. So from a family perspective, I said, I'm going to take some time off. My wife wanted me to not run for re-election. But the third part of your question is, the decision I made then, how does that look to me now? Well, at the time, I thought it was the absolute right direction for me to go, and I still believe that. But I have to confess that the last 10 months, this has not been the path I would have chosen. I understand that I've been, if you will, at times a maverick. I'm on a path where I'm oftentimes talking about perhaps a contrarian narrative about how do we look at COVID-19? How do we look at the data? How do we determine the diagnosis? How do we fill out death certificates? What do we say about personal rights? What do we say about protection of HIPAA? I understand that I'm on a path that I would never have guessed. I remember a year and a half ago when I announced I wasn't going to run for re-election, I remember someone said, well, would you ever think about running for anything bigger? And I said, I really have no right to think about such a thing because I have absolutely no name recognition. I'm just a guy in Carver County. Well, that's changed. I have more name recognition than I ever thought I could possibly have. And I don't know what to think about that, but it is a truth. And so for my future, I don't know what I'm going to do, but I do know that the path I'm on right now, I have to go back to chapter 4 in Esther, verse 14. When Mordecai issued a challenge to Esther, he said, have you thought that you're in the position you're in for such a time as this? And that's on my mind deeply. So I don't know what the future holds, but I know that when I decided to not run for re-election and to focus on my family's health, it was the right decision.
I could just make a comment, Mike. Thank you so much for that, Scott. I just have admired you and appreciated your maverickness. And Teresa Kittredge has really sung your praises, and you're right. She leans liberal, and she just said she is really trying to do the good work. And I've seen that in you, and I've appreciated that. And I think it's people like you that will help make us all come together. So it was hard for me to see you not run, but I totally understand that. And I'll just say again, as I've been saying, how much I appreciate the work that Dave Bartholomew is doing with our counties in helping us bridge divides. You know, he's got us talking one-on-one, Bill Doherty's having us talking one-on-one with his Bridging the Divides work, and Dave Bartholomew's working with us to, you know, bridge divides among counties so that we can work together and really get things done for the people. So I appreciate your work in that and really trying to live your values while you're while you were in the legislature, and it was sometimes a tough spot. So thank you.
The one last comment I'll share is I think it might be called the Better Angels. It's a program that I went to. We had one in Chanhassen about a year and a half ago, and it was really quite an exercise. It was like a 4 or 5 hour sort of seminar, and we divided into groups, and it was very intentional as to how do you learn to understand the other person's perspective. And I think that we all need to do more of those kinds of things. I think it might be called Better Angels, but I know Bill Doherty's had a lot to do with it. And I've known Bill for some 30 years indirectly because he used to work a lot with Mac Baird, and Mac Baird has been a friend of mine for years. But thank you, Mary.
And I'm glad you did that. And it was called Better Angels. They had to change the name to Braver because someone sued them for Better Angels. But you're right, it's exactly the same group, Scott. And thank you for participating in that.
Scott, we have another question from Mary Kay Zinowitz. Mary Kay.
Hi, Dr. Jensen. Really great to hear you. I listened to you on your YouTube, and thank you for all you're doing. And I want to reiterate, you are made for this time. So I hope you will pursue your political career because we need you. And with that, I want to share how much I appreciate your bipartisanship. And we live in a world where we have been perpetually saying where like-minded individuals come together. We have a radio station, public radio station, that's been saying that for years and years. And you know as well as I know that like-minded individuals, when they come together, the consequence is ignorance. And we get dumber and dumber the more we hang around people like ourselves. I appreciate that you are extending your views and opening your heart to listen to others, because this is how we engage and improve and learn from one another. And I just want to commend you for your strength in all you're doing politically and in your stance on COVID, and when it's hard to have a different view and be able to say it in such a hard time right now. We need champions like you to represent us. And thank you for not being with like-minded individuals all the time, because that is not productive. I'm thankful for having friends and that think differently than me. We won't always agree on, like you said, 10%, but the majority of things we all want the same. And our country needs a thinker like you.
Thank you.
Dr. Jensen, we have another one. Kurt Stockford. Kurt.
Unmuted. Thank you, Dr. Jensen, for bringing core values, character, and common sense to the political process. You're absolutely right that at a time like this, those are the things that we need more than anything else. And so every time you have a chance to illustrate those things to us or to any other audience, I certainly hope you'll continue to do that, because as we spread the word, we have to hope that indeed it will find traction. And so I thank you for also bringing up Braver Angels. I had the opportunity yesterday to take the Braver Angels workshop, Bridging the Political Divide, and I can highly recommend it to everyone. Also, I proudly display a yard sign, which is new to Braver Angels, which says, "Hold the country together." And so I would like to promote that too. So I thank you for bringing it up. Thank you for being who you are, and continued success with all your endeavors. Thanks.
Thank you. If I could make a comment, I remember in 2016, obviously it was a tumultuous election, And I remember I had a little bit of money left over in my campaign treasury, and I had won, and then I was going to get sworn in January of 2017. So I told my wife, I said, I really think our country needs to pivot. And so I bought a billboard for a month, and I posted a Christmas message, and it had a beautiful Christmas tree and a wreath, and it said, "Time to heal." And I think that that's just pertinent, more so today. This is a time to heal, and we don't heal. We don't heal by continuing to pick off the scab. Sometimes if you want a wound to heal, the best thing you can do is put a little ointment on it so that it doesn't get so dried out and so harsh and crack open, but instead it provides a certain softness. And in that softness, I think that's where we start to find that common ground.
Dr. Jensen, I have another question from Maria Kim.
Sean.
I'm sorry.
Yeah, it's Maria Kim on my Facebook. So am I on? Okay.
Yes.
So doctor, I'm a Korean American, and I was in Korea in June, end of June, and I came back in August 1st. And how South Korea is handling COVID, this pandemic. And now, today, South Korea, with the 55 million people, 488 people died. And I don't even want to talk about how many people die in this country. I love this country. I have been here for 50 years. But it really big question in my mind, great country like us, how can we kill almost 250,000 people? I don't want to blaming on politics. I don't want to blaming on this to point to finger to one person, but I'm just so embarrassed. This can be controlled. And one of the things that I really learned, South Korea is a freedom. They're not communist country. And everybody wore mask and everybody follow the rules, something that I think mask is very important. So can you just tell me, as a doctor, as a politician, what do you think what's happening in our country now?
That's a great question. And thank you, ma'am, for asking that question. It's not an easy question. I think that context helps. I know that in 2018, we had 80,000 people die of influenza, but it really didn't powerfully impact on people like COVID-19 is this year. Clearly, we've had 250,000 people die in the United States, and approximately 70% of those folks are in long-term care facilities. And every death has its own sense of tragedy about it. And yet, every death, if you will, doesn't necessarily have equal impact. I think if a person, I have a patient I'm thinking of right now who's 102, and her primary concern isn't living another 2 years or 4 years or 6 years. It's that whatever time she has left be time with hugs and touches and love and personal contact. And I understand that. And yet, when I take care of families who have to go through a suicide from a 35-year-old person who felt like life was overwhelming and not worth living, we're looking at 40, 50 years and a family without a father or a mother. So I think that as a society, I'm not certain that as Americans that we've done maybe some of the hard work that maybe South Korea has done. I'm not sure. I think that if you look at our ability in this country to even support programs like advanced care directives and living wills, it seems like we run from some of those conversations. I think sometimes our policy leaders are not helping. We insulate ourselves from certain realities. And I think we have to own that. In terms of what policies work the best in America to, if you will, reduce the number of deaths, I think the science is still out. Intuitively, would masks prevent the transmission of a certain amount of viral particles? Certainly, intuitively, I would think it does. And I think there was a study that came out in Japan about a month ago where it was a pretty large range, but the study indicated that anywhere from 28 to 42% of small particle transmission could be prevented with certain types of surgical or cotton masks. So then that has to beg the question, okay, is the remaining 60 to 70% of transmission an adequate viral load to cause infection? If it is, then what's, if you will, the yin and the yang? What's the benefit and what's the downside? If you look at data from 2000 to 2019, it looks a lot different than 2020. Southeastern Asian countries have been willing and more accustomed to utilizing masks more readily for years. And it may well be that the United States is just simply behind. I don't think we know the science right now. And it seems like at times our political leaders are pandering, dependent upon whatever political issue will get them more votes. So for me, I still think that the things we've done throughout the course of human history, cover your mouth when you sneeze or cough, don't go out if you're sick, don't expose others. For respiratory illnesses, try not to touch your eyes, your nose, your mouth. We have a country that has asked us to wear masks because it might help. So I wear a mask. Do I think the science on masks is as solid as the science on covering your mouth and don't go out if you have a fever, cough, and shortness of breath? No, I don't. I look forward to those questions being answered. But I'm not going to get into some sort of a hostile tug of war on this issue. I think we all have to say, we're in this together. What can we do going forward? I do think lockdowns have far more damage than we realize. And I don't think that we should be indiscriminately using a one-size-fits-all lockdown approach. I do think it's best to have kids in school, and we should do everything we can, particularly the group of kids between 5 and 12. I know I answered a little bit more than you asked, but I thought that some of these were underlying issues and I wanted to address them.
Well, actually, South Korea never locked them down.
Okay.
What they did was, most important thing what they did was wearing masks since January. Okay, they never locked that down, locked the country down. What they did was they tested like crazy. They just tested, and then quarantined, and they follow the viruses, not locking down. You know, and when I was in South Korea, it was just bust of people out there, but everybody was wearing masks. So, for example, Germany adopted how Korea did, and then if you look at the number charts, they're way better than other European countries. So one thing that if I wanted to say, relationship matters. That's why I asking this question. Internationally, you know, America is a great place. I love to live here, but I love Korea too. But I really think that if we cross the borderline and really listen, like if we send some people to South Korea to say, what did they do? I mean, 55 million people, they live there. It's a so small country, and only 488 people died. That's like, it's not like 10 million. I mean, Minnesota has 5 million people, but you can see the number. So I really wish that we unguard ourselves, be a little bit more humble. You know, America, our sentiment is we are the best in the world, but we can be humble and we can listen to what other people do, whether they're yellow color skin or black or purple or white, you know, and they just kind of see what scientifically they did or culturally they did. One thing about, older people died. Well, in South Korea, they have like, they care about elders. Maybe that's culturally something to do with what they have done, you know, but it just puzzles me. And right now, you know, in surge of this virus, people might think, well, it's not me. But if you ask around, I have my business manager who works for me. She has 3 different families. They lost their family member by coronavirus. So it's just relationship, communication. I really like what your idea is to implement things for our country to make it strong, because this country will need America. Thank you.
Great. Thank you. Thank you very much, everyone. I know there's a couple comments in the chat. We're sort of running short on time here. I did notice that I think Karen Schwab put in the link to Braver Angels. And so if you have an opportunity to see that. Dr. Jensen, thank you so much for being here today. Your optimism, I think it embodies our creed, our plaque. We're going to send you along a copy of this. We'll get it to you here in the future. It'll probably come in the mail. We won't be delivering in person. But thank you so much for being with us today and giving us some more insight on how to be optimistic and building character. So thank you very much.
Thanks, Scott. We really appreciate it.
Thank you very much for having me. Have a great day.
You bet.
Yep. You too. Thanks.
Thank you, Dr. Jensen.